Hi, welcome to yet another episode of House of Wellness. आज हम physical component के बारे में focus करने वाले हैं. Today we are going to focus on lung health. I have with me Dr.Avya Bansal, who is a chest physician and sleep medicine specialist attached to the esteemed Bombay Hospital and Medical Research Center, Mumbai. He is one of the youngest recipients in the world of the prestigious Fellow of the Asian Pacific Society of Respirology and is an honorary chest physician to the Mumbai Police. So, welcome to our show, Doctor.
Hi, good morning, Sonam. Thank you for inviting.
Thank you for sharing your valuable guidance, which we are all very eager to listen to. So without wasting any time, let me come to the first question. Seniors के बारे में जब हम बात करते हैं, so what are the specific lung problems that they face?
So when we talk of the elderly population, a plethora of lung-related issues come into the fore. The most common being chronic obstructive pulmonary disease, which is COPD in short in layman's terminology, or smoker asthma as common people know. It has an emphysema and a bronchitis predominant phenotype. And the general risk factors are environmental pollution, smoking, biomass exposure. Followed by adult onset bronchial asthma, again, which can be triggered by a genetic atopic factor, indoor and outdoor air pollution, and high stress and obesity. The third most common illness in the elderly population is lung fibrosis in layman term, or interstitial lung disease.
Okay.
Now, interstitial lung disease in Mumbai city is most commonly caused by pigeon exposure. So we often don't realize how bad pigeon exposure, feeding pigeons, pigeon poop can damage our lungs. So this we have been trying to, through Medium, through Times of India, various news channels, tell everybody that please don't feed pigeons, clean the pigeon excreta, have a clean and healthy environment around your house also, because indirectly it impacts our lungs. So hypersensitive pneumonitis being the most common interstitial lung disease or lung fibrosis in our city, followed by idiopathic lung fibrosis, which does not have any cause to it. It generally happens above the age of 50. And you have your connective tissue diseases like your arthritis, lupus erythematosus, which result in connective tissue disease, interstitial lung disease. The fourth most common illness in the elderly population becomes lung cancer.
Okay.
Now, again, the risk factors for lung cancer is progressive smoking and environmental pollution and occupational hazards. But more or less, lung cancer is smoking associated in men, and in women, it becomes an age-related and occupational associated hazard.
Okay.
Fifth most common illness in the elderly population becomes your lower respiratory tract infections or your pneumonias. Okay. This is your community-acquired pneumonia, which can be transmitted by coughing or sneezing from one infected person to the other infected person. They may not affect the general population as much as immunocompromised patients. So your elderly patients with your diabetes, kidney issues, liver issues, cancers are more prone to developing these infections, which may not normally infect normal population. Okay. So these are some of the illnesses which we commonly see in the elderly population.
All right. So how do we improve lung capacity? How can we deal with these illnesses? How can we sort of prevent them?
So the best way to improve your lung capacity is to walk and exercise. So I recommend all, not just patients, every individual, irrespective of their age, to have a good exercise regime on a daily basis. 30 to 45 minutes, 5 days a week at least, will ensure that you have a decent lung capacity. Okay. Beyond that, any form of physical activity is good. Now, we often confuse walking during work as our exercise. Now, what we do during work, that is a daily activity. True. That's not a form of exercise. A form of exercise is the time spent dedicatedly for brisk walking, jogging, swimming, running, etc. That counts as an exercise regime. So this indirectly increases your vital capacity and lung capacity and reduces the air exchange and air dependency and trapping in the lungs. That's one. Secondly, what else can we do to prevent this is ensure that we wear a mask when we are going outdoors in a polluted environment. Wear a mask indoors when we are cleaning, dusting, cooking, to prevent the toxic exposure to indoor air pollutant fumes, which we often don't realize.
Okay.
But your current use of excessive sanitizers, incense sticks, agarbatti, dhoop, all out, even your cooking gas, cooking fumes, all these become major causes and risk factors for asthma and COPD, especially in women, because they are the ones who are maximum exposed to these.
Right.
Third, what we can do is we vaccinate our elderly population. with influenza vaccine, which is being on a yearly basis, and pneumococcal vaccination, 13 and 23. 13 being once in a lifetime and 23 being twice in a lifetime with a gap of 5 years. And obviously the COVID vaccination, which everyone should take, followed by a booster dose.
All
So
right.
these vaccinations can also prevent a severe and fatal disease, followed by a proper diet. A good respiratory diet is a high protein diet and a low carbohydrate diet. You're going to enlighten us more on the diet aspect. This is just one line on it. So all in all, a good balanced lifestyle with no smoking, tobacco, moderate amount of alcohol or no alcohol, and avoiding excessive exposure to any toxic fumes should be the way forward.
All right. Thank you. Is there any specific exercise specifically to increase the lung capacity जिसका थोड़ा damage हो गया है? What can we do?
So generally, I recommend all patients to buy a 3-ball spirometer or a single ball spirometer. So
Okay.
this is a 3-ball spirometer looks like. You've got 3 balls. You place the mouthpiece in your mouth, take a deep breath so that all the balls go up.
Okay.
It corresponds to 600, 900, and 1200 cc. That corresponds to your inspiratory capacity.
Okay.
And once you increase the lung capacity to 1200, then what you can do is you can invert it.
Okay.
And then exhale out so that all the balls go up. So
All
this increases the lung capacity. Also, it gives us an indication as to the lung capacity is improving with time or it is deteriorating with time.
Okay.
Cheap and inexpensive device, which is a spirometer, which helps us to monitor the patients once we start them on therapy and treatment as well.
Right.
Apart from this, pranayam, yoga, deep breathing exercises, holding your breath for a long period of time, again increases the inspiratory capacity and reduces air trapping in individuals. These are some of the things which our elderly population can do.
All right. So this is like a lung function test that you can do practically every day at home.
Yes. Indirect way of a lung function test. You just monitor how your lung capacity is. Yes.
Right. Okay. Thank you so much, doctor. Those were absolutely valuable tips. And I'm sure the seniors will now start, doing all these kind of exercises that you mentioned. They will ask their medical healthcare practitioners about the vaccines, which are so important. Thank you. Thank you. Thank you so much. And cheers to wellness.
Cheers to wellness. Thank you, Sonam. Have a good day.